All right. Good afternoon to you all. Before we begin, just remember the usual, which is to mute your microphones. And when you want to ask questions, send us video and audio. Delighted to be joined today by Melissa Fleming, who you all know, our Undersecretary General for Global Communications, to her first virtual appearance at the noon briefing. She's here today to announce the launch of the Verified initiative to combat the growing scourge of COVID-19 misinformation. So Melissa will make some opening remarks and take your questions. And then after she's done, we will move to the regular noon briefing. And after that, we'll be joined by Keith Cressman from the FAO's, from the Food and Agriculture Organization. And Keith is the Senior Locust Forecasting Officer. And he'll be here to talk, obviously, about the locust infestation in East Africa and other parts of the world. So, Melissa, welcome, and the floor is yours.
Thanks, Steph, and hi to all of you. I wish I was with you in person. It's actually my first noon briefing. So, and it's really important subject that is close to my heart that I'm bringing with you here today. Because in our view, this is not just this century's largest public health emergency, but it's also a communication crisis. And it's not just because there's a scarcity of information. On the contrary, and I think you'll agree with me, there is a glut of information. But fiction is often circulating faster than fact, and it's endangering public health response, and ultimately it's endangering people's lives. Purveyors of misinformation are creating storylines and slick content that are filling information voids where science has no answers. They offer promises of cures that have no evidence of benefit or may even be harmful. They are savvy about using narratives that link to people's fears and appeal to people's need for answers or need to find a culprit. So while misinformation also has a dynamic in this crisis, there are signs it always has had a dynamic in this crisis. There are signs that its role is increasing. You have, I'm sure all of you have seen the flood of new conspiracy theories in these last weeks. And we're entering a new phase where the information needs are also becoming more complex as the crisis intersects with the growing economic and social strains on societies. So while we still need the basic guidelines, stay at home, wear a mask, etc., we're seeing new information needs and a disturbing rise in hate and stigmatization. And we expect a further increase of targeting of particular groups. Unfortunately, in the algorithm-driven social media era, the popularity of a post often has more influence over who sees it than whether it is factual. So the social media platforms have committed to taking down or are putting up warnings about dubious information and are even guiding people to the WHO website or websites of national health authorities. But we believe this is not enough, particularly because the most pernicious misinformation and conspiracy content spreads via messaging apps peer-to-peer. Spreading online, in some cases, faster than the virus. Just to point out, the Edelman Trust Barometer that was recently issued noted that 67% of people out there say that they worry about fake news and false information being spread about the virus. And half the people surveyed said they were searching for reliable and trusted information about the virus and its effects, but they were finding it difficult to find it. So people are hungry for information they can trust, and they're turning towards institutions and scientists in ways that we haven't seen in decades, also according to polls. And we're seeing also, the role of the UN is needed as more than ever before in providing that kind of trusted voice and the science and the facts. So just wanted to point out a recent study by the British Medical Journal that concluded that over 1/4 of the most viewed videos on YouTube about COVID-19 contained misleading information. And I'm saying this because they also concluded that this was not because factual and good information by scientists and institutions and health authorities and international organizations like ours had not been uploaded to YouTube. It was because they were just videos that were not compelling or appealing or entertaining enough for people to want to view them. So this leads to why we're announcing this new initiative today. I think you have seen that we have been working around the clock, communicating to you, and on our platforms. We've been promoting WHO guidance and SG policy briefs across our UN platforms. We're seeing a phenomenal growth in people who are turning to our platforms, who are following us on social media. But we will not win the communications war with only press releases and fact sheets. And this is really a digital battlefield. And we believe that we need to bring in sophisticated new methods. And this exploding need for information is coupled with this metastasizing proliferation of misinformation, and it just underscores this new need for a new way of communication. So we are collaborating with the organization, one of the world's leading social mobilization organizations called Purpose, to launch today an initiative called Verified. And Verified is going to be, among other things, but very centrally, inviting the global public to volunteer to counter this growing scourge of COVID-19 misinformation by sharing UN verified science-based content with their communities. This content, though, will be better packaged and more digitally and social media optimized. Also, there'll be content created for broadcasters and radio stations. But these volunteers will be described as kind of digital first responders. They will receive a daily feed of verified content with simple, compelling messaging optimized for social sharing that either directly counters misinformation or fills an information void. We know that people are actively looking for ways to help, sitting at home at their computer, and we believe that people will sign on to feel this, to take on this vital role of countering misinformation. And so that's why we're issuing this call to action today. In addition, we're reaching out to member states, also UN media partners, celebrity supporters, messengers of peace, businesses, and importantly, the social media platforms that hopefully will help us disseminate and also counter this misinformation. And finally, just, we obviously our targeted audiences for the initiative are generally people who are being targeted for misinformation. We have teams. We're partnering with an organization called First Draft News that is closely monitoring the spreading of misinformation, where it's coming from, and we will prioritize audiences that are receiving this misinformation and sharing it as well. But we'll also focus our content on support for vulnerable populations and countries through content that is also focused on inspiring people through stories of the best of humanity, as well as opportunities to build back better in line with the SDGs and the Paris Agreement. Thank you very much. Steph.
Great, thank you very much, Melissa. I think Edie Lederer from the AP has a question. Edie?
Thank you very much, Melissa, and on behalf of the United Nations Correspondents Association, thank you for doing this briefing. I have a couple of questions. First, is there going to be some specific website that's going to keep track of this project? And secondly, how many digital first responders are you hoping to get? Are you talking about hundreds, thousands, more? And Is this something that that the UN is going to actually be doing outreach on in all of its member states?
Thank you, Edie. Very good to see you. I'm not muted, right? Thank you. Yes, a very good question about, let me start with the second question. We are hoping to recruit information volunteers or digital first responders in the millions, and we will be reaching out across the world. We'll be using our UN information centers, country offices, as well as just, the weight of our celebrity supporters, many of whom are very excited about helping us to share this. And Edie, I am so sorry, but could you repeat the first question? Oh, the website. Yes, there is a website. It's called shareverified.com. We will be putting it in, I think, when the press release goes live. But yes, there will be a website. It will have all the content, so people can go and refer to it and see what's going out there. It's going live as we speak. You're the first ones we've talked to about it.
Thank you. Evelyn?
Hi, good to see you, Melissa. Are you doing radio and TV for the many countries that people who don't have a computer, or are you doing cell phones also for people who may have that in developing countries?
Hi, Evelyn. Thanks, and great to see you too. Absolutely. I mean, initially, this information is spreading mostly misinformation online. So this is our starting point, but we are definitely going to be producing, depending on where people and how people receive information, content that works for radio, that can be broadcast on TV. So absolutely, I think, the starting point is who we want to reach and how they receive information.
Thank you.
Thank you very much. All right.
Any question? All right. Let me just see if we have any more questions. Florencia, if you could please send me a text because I'm having some. Okay, Florencia, any more questions? I'll read one from Iftikhar Ali of Associate Press of Pakistan, who's not able to connect by video. He asked, you've done very well in identifying the problem, but please elaborate a bit more on the steps to counter the phenomenon of misinformation, especially in developing countries.
Yes, thank you very much. Again, there's not a be-all and end-all solution for all countries. So we are definitely going to be taking, not just a global approach, but also working locally with our country offices in identifying the misinformation that is particular to a given country. I mean, some of it we are aware is starting in Western countries and spreading all over the world. And where that is the case, we're going to be doing two things. One is working with the social media platform to find ways to actually get this off the platform, really go to the root and the source, if possible. Obviously, this is very difficult. We've seen that for example, the film Plandemic has, continues to emerge and emerge and emerge, even though it's been taken down and down and down. So we have evidence that the misinformation and the conspiracy is filling voids, information voids. And so that's our other strategy, is really to be out there with good and trusted information and to start to be, recognized more as the place to go, to provide links to, in country, to sources where people can go, but really to reach them and then to lead them back to where they can get source information, or just put that information out there in ways that the health authorities or other institutions are unable to do. So it's a multi-pronged strategy, and it really depends on what the local situation is.
Thank you. And then I think you have time for one more question. That's from Philippe Ratter at AFP. Philippe?
He said he had internet problems, Steph.
Ah, okay. Who doesn't?
Do you want me to read his question?
Yes, go ahead.
Okay, he said he didn't understand who is going to verify the information.
Mm-hmm. Okay, most of the information comes from already verified factual scientific information that is, in UN reports, in our data, in our press releases, in our policy briefs, in WHO guidance. It's just not been packaged and produced and disseminated in ways that are reaching the people who need to see it, and enough people. So that's what I would say, for the most part, that's where all the information is coming from. However, we are going to be, because our slogan for this is also science, solutions, and solidarity. And we are going to be also promoting a lot of content that will counter some of the division, the nativism, the hate speech that we're seeing growing, with stories of acts of humanity, of solidarity in communities and across borders. We also hope to indirectly promote global cooperation and the need, being together, one world, etc. So sometimes we might take external content for this, and we will have a team of fact checkers who will make sure that these people, just like news organizations do, this is an organization that works for news organizations, to make sure that whoever is being depicted in the story is a real person, and the facts surrounding it are accurate, and the timeline is correct.
Great. Melissa, thank you so much. We'll start with the regular briefing, and hopefully next time we'll all be on the same podium in the briefing room.
I hope so. Take care, everyone. It was great to see you.
All right. Thank you. Take care. All right. Back to our regular programming. Abdelhamid, I'm sorry. I just saw now you wanted to ask Melissa a question. If you want to send it in writing to us, we'll get it answered. And I apologize. And just